This case study is on a 19-year-old competitive cheerleader who also does gym-based cardio and stretching. They've been diagnosed with patella tendinopathy and they are in the reactive to disrepair phase. During the last 6 months, anterior knee pain has gradually increased on the apex of the patella. This area also stiffens up after sitting. Cheerleading drills and running also aggravates the patella tendon. These aggravating factors are eased with rest and by following the police principles. In assessment, we found slight knee valgus, tenderness at the patella tendon, tightness at quadriceps and hamstring, and the strength being scored at a 4 out of 5. Pain was also found during the inner range of a quadricep contraction, rated 3 out of 10 on a VAS. The cheerleader was also unable to perform a single leg squat or a drop jump due to pain.
So to start your patella tendinopathy rehab, we're going to do an isometric exercise with a seated leg extension that's going to be banded. So there's going to be a band pulling on your leg as it's at a 45 to 60 degree angle, just creating a bit of resistance. So are you alright if I show you an exercise and you do that?
I'm happy,
To do the seated isometric leg extension, you need to sit on the bench with a straight back. Once sat down, place your leg into the band with the resistance band being on the lower part of the shin. Once set up correctly and the band is at the lower part of the shin, you're going to push against the band into a 45 to 60 degree angle with a slight bend in the knee and hold this for around 30 to 45 seconds, making sure there is no movement but activation at the quadriceps. Repeat this for 3 sets. When coaching this to the cheerleader, I made coaching points before and during the exercise. I made a point on the athlete to keep a neutral spine, which prevents strain on the back when doing the exercise. My next point is to gradually contract the quadriceps when getting into position. This is to prevent sudden pain at the patella tendon, which can cause stress. The next point is to make sure the knee is facing forward, which helps prevent knee valgus. To progress and regress this exercise, the resistance band can be changed, increasing or decreasing the resistance. Throughout the exercise, I used communication with the athlete, asking if they were okay doing the exercise, and then I would communicate any improvements if needed. Now I will talk about progressions and regressions from this exercise.
So for a progression exercise, we're going to do the Spanish squat. It's an isometric exercise that we hold at say 45 to 60 degree angle. So I'll give you a demonstration. So you get in, one leg at a time, at the back of the patella. Step out, so there's a bit of resistance. With your feet facing forward, knees facing forward. You squat down into that angle and hold for 20 seconds. Okay? You alright with that?
Yeah, happy.
Make sure your back's straight, your head's up in a neutral position. Just hold it, right? Just squat down. Yeah, hold that. Good. You're not in any pain in that position? No. Okay, good. From the muscle leg, yeah? Good. Keep holding it. Yeah, that's good. So as a regression, we can do a wall sit. So we're going to go against the wall, back against it straight, and just go slightly down to that 45, 60 degree angle and hold it. Right? Yeah. You okay to do that?
Yeah, I'm happy to do that.
Yeah, hold it just there. Yeah, good. Hold for 20 seconds. Good.
To conclude this video, the isometric seated leg extension is a very good exercise for managing patella tendinopathy. It's very good for reducing pain, restoring tendon capacity, and strengthening the quadriceps. In addition to this, the Spanish squat is a good progression due to the increase in load and range of movement. The wall sit is a good regression due to less strain on the patella tendon.